Hello.
Om Shanti, guys. How are you, everyone?
Hi, we're good.
I'm fine,
Okay.
thank you. And you? Better?
Okay. Let's start the session. Come into the sitting posture. Keep your back neck straight, align. Gently close your eyes. Go into your sit. Observe your alignment, how you are sitting. Now, take a deep, prolonged, slow inhalation. Deep, prolonged, slow exhalation. Inhale and exhale with awareness. Now inhale for the 3-time Om along with Shanti. Take a deep breath. Shanti, Shanti, Shanti. Feel the vibration and sensation. Join your both palm. Wrap your palm. Place on your eyes. Very slowly while blinking, looking at your palm gently. Open up your eyes with a great smile and say motion. Ouch. So, till now, we are discussing about the Vata problems, and we covered the mm, we talked about the diet of the Vata related issues. I talked about that how one should consume. Even the drinking the water is very much important. They have to drink the water in the copper bottle, Usha Pankriya, they have to take it, following the rest of the things. Yes, the diet part we covered in detail. Now come to the asana practice. What asanas would be, best for them? So people who are having the complaints about frozen shoulder or stiffness in the joint or any, ligaments partially, they feel the problems in there. So how you can help them? You cannot teach this Ashtanga Vinyasa or the Vinyasa flow. You have to teach them Sushmyam. If I'll write it down for you, this practice called Sushmyam or Pavan Mukta series. Ve. Mhm. Sushma Vyayama. Sushma Vyayam Pavan Mukh series means like Griva Shakti Vikas. I'm just giving you the name, don't worry about it. And these are the Sanskrit terms for the movement of synovial joints. So, Griva Shakti Vikasa Kriya, right to left, up and down, these three practice, and then pressing. Those who are having the spondylitis, they can practice this Sushmyam, giving the pressure one side and the back side. It's called Griva Shakti Kriyas. Okay. So it basically movements of your pivot joint. This neck is a very having the fragile joint, synovial joint, which we call pivot joint. And if you give all the movement, if you work on the all the movement of the neck, it improves the blood circulation around your C1 to C7 area, and that reduce the pain of the spondylitis. So spondylitis, whoever gonna have, they have to activate the neck movement a lot. They have to do the more on these activities. But one thing they have to not do, that is forward. This one they cannot practice. Okay, forward they shouldn't be dropping their neck. So not coming to the tremendous pressure on the neck. But the backward, like this, if they're doing the rotation, Griva Shakti Chakra, that neck rotation, so they have to go with the half one. Keeping the back straight and just rotating like this. And one more thing, precaution, not forward bending. Okay? And understand, if you are keeping your neck like this and rotating sideways, and meanwhile, whenever they do any chores, house chores or any activity they indulge into it, they have to wear the neck band. Neck band is available in the market, you can buy and cover your neck. So neck should be straight, it has to be straight. So not because of your wrong posture, you're not giving the pressure to your C1 to the C7 vertebrae. Otherwise, instead of sorting out the problem would be aggravated. So these precaution one has to take. And yes, what asan they can practice to improvise the blood circulation around these areas. Otherwise, there's no cure for spondylitis in the medical or the allopathy. They give you the painkillers, which or and painkillers or inflammatory drugs, so which reduce the inflammation. That's it. But understand, because of the wrong pressure, the things already you give the disc is bulge out and giving the wrong pressure to your nerves. So treatment for that, the surgery. But what we are doing by doing these practice, we are strengthening the muscles, bones, ligament, fascia around your spine, your neck area, and then you are also improving the strength of your nerves by these activities. So problems would be there, but symptoms gonna be reduced, and then you slowly, gradually correcting the posture of your neck. They shouldn't be doing any forward bending where they require the neck bend. But rest of the backward bending or the other practices, um, they can do. So just give me a 1 second. Yeah. So they shouldn't be doing these mistakes. What other asana they can involve? Simple practice. Okay, simple mobility of the synovial joints, neck, then shoulder movement. This call poon, you know, like movement of your shoulder, Poon Bhuja Shakti Vikasa Kriya, anti-clockwise, clockwise. It also improves the strength of your neck and the your this shoulder joint. Okay, so pectoral joint is also the most important part. If your pectoral joint is weaker, it's gonna also give the pressure to your neck nerve. To understand these two parts are very much important. Even if you're giving the classes to the spondylitis, you have to, along with the neck, the shoulder movement should be practiced by them. Then up and down, these activities they can go for it. All the direction you learn the movements of the all the joints: flexion, plantar flexion, dorsiflexion, circumduction. These all the movements you have to make with the joints. Don't anti-clockwise, clockwise, all the direction. Okay, you have to apply it. Strengthen those areas slowly, gradually. Not these. Don't make them to jump like monkey here and there. Okay, otherwise, um, problem would be, instead of giving the solution, you're gonna break their joints, because joints are now more fragile. They have sickness. Now, then Angli Shakti Vikasa Kriya, movement of the finger, then stretching like this, Kohuni Shakti Vikasa Kriya. I'm just using the name. You shouldn't be remembering. You don't require to remember. Just remember the movements and the instruction. Okay. Involve each and every joint's activity, so you improve the blood circulation and it open the prana. Why you, if your pranic energy somehow blocked and nadis are blocked, it's gonna walk on the deeper level of the pranmaya kosha. If you practice very slowly, with as slow as you can move, with lots of awareness and with lots of breath, deep inhale when you're moving, deep exhale, then anti-clockwise. This, if you relate your movement with your breath, then it work wonder. There's no cure for this, but believe me, if you learn the way I'm telling you, you're gonna practice. It gonna, I mean, you can come out from the even aggravate condition of the any area of your body where stiffness is there, frozen shoulder is there, spondylitis or lumbar back issues, anything they have, arthritis, rheumatoid arthritis, they will come out. Now, these two things we covered. If they have problem, yes, doctor tell you don't move your shoulder, but yes, in the yoga practice, you can press the wall. You can take the help of physiotherapist. Even physiotherapists tell you the most of the movements, but you can make the yoga practice. Learn the practice from them, and you can attach the breath. Then it becomes sushmayam. So sushmayam, there's a one kind of branch of the yoga, pre-practice of the asanas. And I don't know, many schools are stopped talking about it, but because now the students are not available for, they are not interested to learn the slow kind of practice or pre-practice. They don't have much patience. But actually, this is the true level of the healing procedure when we talked about the treatment and healing and the working on the cellular level of deep tissue level of the healing. These practice should be given to them. You can do the research over which school is teaching you learn those practice. There's a big branch for that. Okay. So go for it. It's wonderful if you include the therapeutic asanas to your class. Okay. So you can press the wall through your palm, and then you can give the activating the muscles of your right muscles, and by step muscles would be activated. So not giving much pressure, and see how much movement you can make. That movement you can do slightly. Don't give the pressure. Slowly, gradually, they have to go for the up and down, sidewise, and slightly circumduction movement. That according very slowly. You have to be very gentle. Now come to the other parts of the spine. If anybody has the back related issues, the asanas which work wonder for them is the Bhujangasana, all the variation of the Bhujangasana, where you have to keep the distance between your feet in order to reduce the pressure of the back. Okay. I hope you learn this variation in the asana practice. If you are not learned, please enroll yourself some offline courses where you get these idea about it. Bhujangasana work wonder. Bhujangasana, then locust posture, locust cobra variation, then salabasana. In English, we call locust posture. LOCUST, locust. Locust asana, you can, or posture, you can, all the variation. Amazing. Okay. Cobra, locust, all the variation you can practice. Then third is Superman. We fly like this in the prone position. One leg is up. Again, all the variation of the Superman posture, also good for strengthening your whole back area, strengthening your whole spine. Then all the variation of the Markatasana, one can practice. But yes, variation required person to person. That thing you learn, especially offline classes. Okay, offline classes, and the classes which giving the therapeutic asanas, especially traditional based asana practice, or especially hatha flow, all the hatha, a school who is teaching the traditional hatha, all the hatha forms are based on the therapeutic asana. So market, we call market asana for that. Market is like twisting posture of your back. So twisting asana you can include in your sequence, and that also improve the flexibility of your lower lumbar region and middle part of thoracic area also. Strengthening the muscles, ligament, fascia around those area, and improving the strength of the nerve. If because of the vertebrae disc herniation, one kind of problem, compressing your nerve or other things, then it would be slowly, gradually gonna be slowly, gradually you're strengthening that nerve, and then it gonna heal. Okay, problem remain there, but you are strengthening the other parts of the body, because spine surgery would be the last option. Understand this thing. And yes, work on your sitting posture. Most of the spine problems, doesn't matter whatever it is, it happened because of wrong wrong posture you are standing, wrong posture you are sitting, wrong posture you are sleeping. So you have to correct these three posture. Standing when all the feet on the ground, and it has to be balanced. Learn the how to stand. Okay. When you stand, observe that equal pressure you're giving to each foot, equal pressure, and observe the pelvic alignment. It has to be, it's that it has to be adjusted. Pelvic should not be, your hip should not be out. It should be in. People, especially those who are wearing the heels, stop wearing the heels, guys. It's kill you. It's killing your pelvic area. It's killing your these lower abdominal and upper abdominal, and also it's affecting your stomach, everything. I don't know who started this fashion. It's the worst stupid things going on in the society, and it's very crazy. They just want to kill themselves out of fashion. So please don't wear the heels and the any footwear which is pointed like this, which is not comfortable for you. Whenever you stand, equal pressure one should feel on each foot, and your pelvic should be in, not out. Hip should not be out, and you are giving the tremendous pressure to your lower lung raising. That's why many celebrities went for the surgery. So please don't do these stupid. I don't know. I can't say that these people are intelligent, or I don't consider them or educated one. They're the biggest stupid things they are doing to themselves. And for what? For fashion. So many problems happen because you are doing these stupid mistakes. Any person come to your class, first observe what kind of footwear they are wearing it, because it involves in walking. If they don't change their footwear, they say don't help them, don't waste your energy. Then everything, whatever I'm telling you, nothing gonna work, because tremendous pressure come because of their walking, because of their standing, and wrong footwear they are wearing. Many people, they are just taking all the treatment but not correcting these things. Now, after that, if somebody has the arthritis, I told you they have to work in each and every joints portion, from tip of the toe to the fingers to the neck. All the joints should be involved. Those practice you have to introduce to your class. So first, correcting the posture, standing, walking, and then sitting. Yes, back should be straight. Give the pillow, give the support, whatever they required, but make them to sit correctly. And sleeping, another posture which is cause many problems in the back, in the spine, and the other area of the uh, body parts, where tremendous pressure come to the other joints, because 8 9 hours wrong posture we are choosing for sleeping. So don't sleep like this on the, you're compressing your chest. People sleep like this, or on just going extending your hand. And some people sleep on the one side and then move their whole bed. No, sleep should be done on the one side. So you have to lie on the one side. Use the not very puffy pillow. Use the not very soft pillow. Use only little bit harder, not soft, not hard, in between. Okay, in between of that pillow. So memory cushion pillow doesn't use for sleeping. And even um, the bed, people always want the soft. Oh, this is the cause of your pain and suffering. Bed should be flat when you sleep. It should not be go in, like you are not pressing the bed when you are sleeping on it. Your mattress would be flat when you sleep. It has to be mild soft, but it has to be flat. So cotton mattress you can use. Organic jute, there's a one type of grass. They fill in the mattress. That kind of mattress you can use. But yes, for them you have to maintain the cleanness a lot. And then use the side, left side or the right side. When you sleep during the night, always sleep to the right side, so your left nostril would be activated and it help you. So parasympathetic system gonna work, which improve your sleeping. So your sleeping would not be disturbed. Okay. So, and yes, many of you don't know this concept. When this where the sun is rising, the direction of the, when sun is rising, which direction the sun is rising, keep your head in that direction. This small change help you to get the better sleep. What these people, those who are having these issues, they oftenly have the disturbed sleeps. So where sun is rising, keep your keep your head on that side. And yes, during the night, sleep on the right side, and use the mild pillow, and slightly bend your knee and go into the this lateral position. Okay, and sleep. It will take time to change your sleep pattern because you're changing the posture. This help you to give the proper, it improve your Jataragni as well. It give you the space to your lungs to breathe. It give you the rib cage to expand. Your diaphragmatic system gonna work wonderful, and your sleep would be gonna. And if you get the proper sleep, and you are providing the more oxygen during the sleep, then slowly, gradually, you come out from the issues. These things should be correct, okay? Before doing asanas or other things, correct these posture. It will take maximum 1 month, minimum within a 1 week. You're gonna change the sleeping posture. Whenever you wake up, correct your posture. Again, wake up, correct your posture. Keep doing it, okay? Correct your posture in the sleep. If you're taking the nap in the noon time, sleep the left side. So right nostril would be activated, and after having the lunch, you allowed, Ayurveda say, 20 to 30 minutes one should take the nap after the lunch, after sitting in the Vajrasan, and then walk. So this is the golden rule for improving your digestion for everyone. After lunch, sit in the Vajrasan, thunderbolt posture, 10 to 15 minutes, then walk moderately, softly, and then go for 20 and 30 minutes nap, not sleep, 20 or 30 minutes, and sleep on the left side. Right nostril would be activated, and that gonna help you for digestion. Food properly gonna absorb. This is the golden rule. Everybody can implement. Now, after this asana and everything, let's this is all about, okay, soft gentle practice. Sun salutation, yes, you can include the sun salutation, but gentle one, not fast, very slow. But don't include the chaturanga and the difficult posture where they give the tremendous pressure to their joints. And you have to see the condition. If the condition is so much aggravated, then don't include the sun salutation. A, B, and C, and you have to modify it according to the your student's need. Okay, and gently, slowly, and give lots of breathing during each posture. Make them hold, and when they holding it, they have to take lots of breath. They can do the abdominal breathing, like 5 second, 10 second hold. You can give to each asana. When you giving the introducing, making the sequence, make sure mostly asanas should be included on the supine prone posture and the twisting posture. More you have to include in that, okay? Standing also you can include little bit forward bending, semi inversion posture, not advanced one, semi inversion, light gentle vinyasa, you can go with it, okay? But again, hold light hatha flow they can practice. So now come to the pre-practice of the pranayama. Pranayama required major precaution. So we are not gonna touching that part, because for that you require the whole history of your students before introducing the pranayama. So what is a safe practice? They can go for it. So first safe practice is um, the diaphragmatic breathing. Diaphragmatic, there are two breathing which involve your diaphragm, that is abdominal breathing and thoracic breathing. It works wonder. 15 to 20 minutes, abdominal breathing, chest breathing, abdominal breathing, chest breathing. They have to practice. 1 hour morning, 1 hour evening. And now you're gonna say we don't have that much time. So start with the 15 minutes. 15 minutes each. At least 30 minutes should be practice this breathing. Then another two safe practice, that is the yogic breathing and nourish breathing. These two breathing is most important breathing. Okay, four breathing are the safe. It has to be done. No, doesn't matter who is sick. They have to practice this for 1 hour should be morning, 1 hour in evening, and during the time whenever they get the time before having the meal, anytime they have to practice the abdominal breathing before eating and anything which they're gonna eat. 10 to 15 minutes they have to. More they breathe, more oxygen to reach to the lungs and then rest of the body, more quickly they're gonna heal. And when you are having this condition where we don't have cure, then you have to give yourself more time, okay, for these practice. Forget about at least the work and other things. If you remain healthy, alive, you're gonna enjoy your work. If you're sick, you cannot do anything. So please give time to yourself. The people who just complain about it, I don't have time, I'm very busy. Okay, then what we can do? Tell, okay, at least 5 minutes, 10 minutes. Do it. It's better to do nothing, it's better to do something, but it's very much important. Pre-practice of the pranayam is play very, very important role. And this gonna change the coding of your cellular level. Any cell which is damaged or weak or anything happen, this breathing work on that level. So more you do, more you get benefit. Okay. Now come to the other. So apart from this, what other practice they can do? Brahmali Pranayam they can practice. So Brahmali Pranayam, you can start your class, you can end your class, doesn't matter. Even between the during the asana, you can give. But yes, Brahmali Pranayam should be done in the sitting position. So there is a variation of the Brahmali Pranayam. You can introduce your version. Don't worry about it. More they do, more they bring the calm and relaxation to themselves. After Brahmali Pranayam, once you finish the session, now meditation. What kind of meditation one can practice? Makar chanting work wonder. It's work like a Brahmali Pranayam. Makar chanting, MAKAAR, Makar, where which is the part of the pranav meditation. This one. So Makar chanting work wonder, active meditation, little bit dancing. If they cannot sit for longer period of time, you can just and also introduce the yoga nidra to them because they have the sleep problems, any insomnia or any other related to the mind related issues. Yoga nidra work wonder. Before sleep, they can practice the yoga. Okay, so yoga nidra they can practice. Now, one most important part which is Ayurveda and Yoga talks about it. In Ayurveda we have Panch Karma, in Yoga we have Shat Karma. So Panch, Panch. Panch means five. Karma, Karma. Five cleansing practice, Panch Karma. And Shat Karma, SHAT, Shat Karma, KARMA. Shat Karma, six cleansing practice. Shat means six. Six cleansing practice for cleaning the system. As I said, all the problems started when ama is produced by your body, right? When ama is stuck in your body and it's not coming out, we help the body in order to, by drinking the water, salty water or herbs, certain herbs, we we puke, we give diarrhea to ourselves. There's a 6 cleansing practice which clean us from eyes to the digestive system, whole things. So we have dhoti, basti, tratak. I'm just roughly going through it, which is cleansing us.
Hello.
You should, yeah.
Sorry, we have like another class right now. Is there any way we can start earlier tomorrow? And then because we lost some time from today, can we start earlier for tomorrow? Like on time, maybe?
What time?
On time, like at when it usually starts at 3 o'clock our time. Like what time it usually starts?
Okay, yes, 12:30, right?
Usually we have it at 3 o'clock Bali time.
Okay, yes, same
Okay.
time, right? Same
Yeah.
time.
So maybe can we continue from on time next time?
Mhm.
Okay, and then we'll just finish up from today. Okay.
Okay. Bye bye. Take care.
Okay, thank you.
Welcome, dear.